Hi, my name is Dr. Helena Men and I'm one of the ENT surgeons at Melbourne ENT Group. This video explainer is about recovery after rhinoplasty. It is appropriate for patients who have just undergone rhinoplasty, about to undergo one, or even just thinking about it. Rhinoplasty is a surgery that involves restructuring the inside of the nose to often make the breathing better, but it also can change the appearance of the nose. It involves cuts and surgery done internally and also a small cut on the undersurface of the nose, just there. The cut is small, but the surgery is not, and therefore the recovery and the expectations is important to discuss and be aware of. Your recovery after rhinoplasty can be divided into two periods. One is the immediate postoperative period from the minute you wake up after surgery for the first 2 weeks. That is when most of the acute changes happen and most of the recovery takes place in those 2 weeks. However, the recovery after this surgery overall can take up to a year. So we'll talk a little bit more about what to expect the minute you wake up after the surgery. When you wake up, you will have a gauze under your nose to catch some bleeding, which is a normal part of the recovery. You also feel congested and slightly swollen of your nose and around the face. Almost certainly most people develop some bruising under their eyes. There will be dressing similar to a cast on the broken arm over your nose and some dressings and packing inside the nose. After the first 5 days, the dressing on the outside will be removed and the sutures of the external stitching will be removed, as well as the internal packing. It is normal to experience congestion and not being able to breathe through your nose for a couple of weeks after the surgery, even if the aim of the surgery was to improve your breathing. This is because you'll have trauma after surgery, some clots, blood, mucus, and packing inside the nose. As time goes, this will all settle down and hopefully your breathing will be much better. A little bit of blood and blood-stained discharge is also normal. Big bleeding is uncommon, but a small amount of blood is expected. You will be taught to use first aid to manage the bleeding, and it's very rare that you would require a visit to a doctor or emergency department and further management of that. Your swelling and bruising will settle down as the time goes, but application of ice packs under the eyes would often help to improve that. The ice packs also help with pain. Now, pain is usually not a major issue after the surgery. You will be provided scripts for medications to deal with pain. And please follow those as instructed. Applying the ice packs under the eyes, as already mentioned, would also help the swelling and therefore the pain. Elevating the head and sleeping on a high pillow can also be helpful. After the first postoperative visit, when you have your sutures removed and the splints removed and the packing, you will feel better. This does not mean you can go back to your full activities. The first 2 weeks ask you to take it easy. You can go for a walk, you can take a shower, but you should avoid any strenuous exercise or a heavy lifting and avoid leaning forward for a long time. After the first 2 weeks, most of the healing and acute changes would have settled. Your breathing would be almost as good as we would hope for, and the appearance would be also getting closer to hopefully what you expected. Some of the swelling would still be persistent, and that would take months to fully settle down. Most of the people around you would not notice that swelling, however, you yourself would be aware that your nose still feels swollen. We will advise you on massaging and taping regimes to improve that outcome. After the immediate recovery, after 2 weeks, most people go back to the most activities that they can do and slowly reintroduce exercising. The second phase of the recovery is a long-term recovery, which takes place over months. Some of the changes that you would notice would be swelling that is reducing over months, and some massaging generally helps it. You will find the changes with weather or exercising that can also increase some swelling of the nose temporarily. This will be very subtle and usually only noticeable to yourself. Stiffness of your nose would still be persistent. The tip will be stiff and almost woody, and that is unfortunately a trade-off for a nice, strong structure of the nose. Most people are not bothered by it at all. The numbness around the tip should be starting to go away in about 3 months, and the numbness of the teeth should also start resolving. Your pain should not be there, and you should not experience any bleeding after the first couple of weeks. After a few months after surgery, the appearance should be what you expect it to be. However, some changes can still occur because we're not working with steel and wood. We're working with your own tissues. The bone can heal with a slightly lumpiness called callus. The cartilage can curve and remember what it was like before the surgery. Or some of the scar tissue can be more thick and lumpy than expected. These changes take months to occur and can be monitored by yourself and your surgeon. Sometimes revision surgery may be required. I hope this gives you an idea about the rhinoplasty and the recovery process. Thank you for watching this video. For more information on ENT conditions and procedures, please visit our YouTube channel or our website, where you can also download information sheets.